go to the doctor, and get a flu shot. It's not too late to get a regular old-fashioned flu shot. We're in the middle of a busy and vibrant flu season, and flu is still going around, so please take care of yourself. I'm sorry, I was impolite. I forgot to introduce with whom I'm standing. We have Kyle Rose-Lauder, who is the Deputy County Executive for Health and Human Services, Dr. Larry Eisenstein, who is the Commissioner of Health, and I have to give him and his team a shout out. Since this has emerged, he and his team have been working 24/7, staying on top of this, doing everything that they have to do to get ready. And I must add that the Health Department also prepares for this sort of thing all year round. We have a Medical Reserve Corps of volunteers, medical professionals, 1,000 of them, who are ready for any kind of situation that needs their attention. And so I want to thank Dr. Larry and his team for your amazing work. I also want to thank Commissioner Steve Morelli of the Office of Emergency Management, who is with us as well. He and his team are also ready for anything. And Andy Simone and Debbie Kimmelstein of the Health Department. Thank you very much for being here as well. So as I've said, we've got boots on the ground, and we're monitoring this situation in Nassau very, very closely, and have been right from the very beginning to respond to any cases should they emerge in our county. The Office of Emergency Management will be coordinating with supplies and resources as needed with our state partners. We're working very closely with our state partners and federal partners in the health realm as well. Our medical professionals are here today. They'll have more detail on those procedures. For any new information, you can always go to the Center for Disease Control's website, that's cdc.gov, and also obviously stay tuned to your local news. So with that, I'd like to turn it over to Dr. Larry Eisenstein.
Thank you, County Executive Curran, and the support that we've received from County Executive Curran and all of our county administration and agencies has been incredible. We're very blessed in Nassau County to have an incredible healthcare infrastructure, world-class hospitals, world-class providers, and a world-class Department of Health. Andy Simone, our Director of Emergency Preparedness, trains for all kinds of natural and man-made emergencies as it relates to health and directs our Medical Reserve Corps. And Debbie Kimmelstein is our Director of Communicable Disease Control and is an infection preventionist, and they have been working around the clock, leading our actions, interacting with our state partners. We have been following guidance and emerging guidance from the state and federal government. This is a brand new virus to us. We're learning new things every day, and I still don't have the answers to many of the questions that you might ask about the pathophysiology of the virus and things like what is the known incubation period. So we're following guidance which is based on the best available science, and we are working around the clock to help keep our residents safe. There are numerous updates and webinars that come from the state and the CDC on various aspects of the COVID-19 response, and we take part in all of them. And this has been work around the clock, but this is why you have a health department. We're prepared to do it. I'm very appreciative of the work that Ann and Debbie and our staff across the board has done. We've been working on this day and night, weekends, holidays, and we have provided guidance. We have a procedure in place that I'll talk briefly about, and then we can turn it over and answer any questions. We have a procedure in place where, as airplanes arrive, and right now only American citizens are allowed to arrive as of a few weeks back, we receive notification off a list from the CDC that comes down to us of anybody that's coming into our county who lives here who has a potential exposure, meaning, according to the current definition, they've been in mainland China sometime in the last 14 days. It is our job to, within 24 hours of receiving this notice, and as you know, an airplane can arrive basically at any time, to reach out to them, to let them know that we are asking them to isolate themselves, because almost all of them are Nassau County residents. It's in most cases happening in their home. Our team reaches out to them, interviews them, first make sure that they actually were in China in the last 14 days. Somebody might have been in China, and so they're on a list of having been to China, but maybe they went somewhere else in between for a month, so there is no risk. And so we validate the people on the list. We educate them as to the fact that for 14 days from their last potential exposure to the virus, we expect them to remove themselves from other people, including their family members. We help them do that if they don't understand what we need. I'm very appreciative of the help that we've gotten from other county agencies and our Medical Reserve Corps. In some cases, people have helped us translate, and so we're appreciative of all the help that we've gotten. And the process has worked very well. To date, we have received on these lists approximately 320 names since this program started a few weeks back. There have been a total of 175 or so people who have experienced at least a partial time where they were removed from contacting other people. Currently, as of today, there are 83 people who are on our list for being removed from contacting other people. We check in with them every day for their temperature, and we deliver a thermometer to them if they don't have one handy. So we take care of making sure that they do that. They're in communication with us. We're in communication with them. We discuss with them the importance of them voluntarily complying with removing themselves from contact with other people, and all of them to this point have understood that this is a vital part of this. If somebody were not compliant, we would take next steps, but there's no reason to go there because that hasn't happened. We are prepared for all circumstances. We check that they have no fever. We check that they are not ill. Should somebody need medical care, we'll evaluate it, and we have protocols in place to safely get them medical care. But I'm happy to say this process has worked very well, and our team has, some people might come in on day 13 since they've been in China, so they're only removed from other people for a day, and others arrive directly from China, so it could be a 12 or 13 or 14-day maximum window. So this is the guidance that we're following. It's federal guidance down through the state, and a lot of work goes into this. A lot of work has gone into making sure that everybody truly understands what we're requiring of them. Letters are delivered with instructions to the homes or wherever they're staying, and I am very grateful of the fact that we have been able to do this safely. There are no cases confirmed in Nassau County, and that is very important. And we also know that we have an amazing set of healthcare partners, hospitals, and providers, and the state and CDC has been doing provider webinars weekly where they are given updates and go over procedures. As an emergency preparedness unit, we understand that pandemics occur. It's a part of public health. It's what we do, so we train for it. We have measures in place as necessary, and I'm happy to say right now we don't have a case. So we will continue doing what we're doing, and I'm just very grateful to all the support we've gotten from across the county and the state and the federal government, and so far our residents have done very well, and there are no cases. We're going to hope to keep it that way, and certainly we will take whatever actions we have to keep our residents safe. So,
Yeah, that's fine.
Sure.
And then,
Commissioner, in Westchester County, there was a group that just came back from mainland China, and the county actually quarantined them. Can you explain the difference between an official quarantine and asking them to voluntarily remove themselves from other people?
So there are general guidelines, but this is, because it's emerging and new information is coming out, there is a component where each case is evaluated on a case-by-case basis. So if somebody is deemed at higher risk for whatever reason, maybe they were sitting next to somebody who had active contagious coronavirus, the measures that might be taken would be different, such that it might not be considered a voluntary isolation. Right now, anybody coming back from China within the last 14 days, even if they weren't exposed to anybody, is undergoing this remove yourself from the community. When it's identified that there's a potentially higher risk, like they were exposed to an active case, it could be called a mandatory quarantine. The actions that we would expect are not essentially different in that we would want them to be away from contacting anybody in the public, but the consequences for not would be that they could essentially be isolated aggressively on government's part. So I don't know the specific circumstances of that group from China, but that could happen, whereas if we think somebody is of a higher risk, we might tell them, you know, this is a mandatory event, and for you not to comply is legally binding.
Has that happened in Nassau County? Has anyone been told you are mandatorily quarantined?
We had somebody when this first started that was in a different category that exists now. So we did, it was very short-lived, and the criteria has changed. So, but currently, since that very first initial event when this happened, which was actually before this current process is in place, it has not happened.
This could become a pandemic. It could involve more than China. Reassure the public, who are obviously nervous with specifics. What specific plans do you have in place if this becomes a pandemic and starts showing up here in Nassau County?
So we train for pandemic contagion. We call it the flu plan because historically that's typically what's been the most likely thing to cause a pandemic that impacts large numbers of our population. But any respiratory virus or other viruses could become a pandemic. We have a mass flu plan. We have plans that we drill on. All hospitals drill on it. We will be in communication with them. We know so little. This is still a brand new virus. We know so little about things like the mortality rate. What we have an infrastructure where somebody with one of the main complications, as we've heard, is pneumonia. We have the facilities here in our hospitals to help people get through a pneumonia that other parts of the world might not. So we have a plan. We will follow it. To speculate exactly what steps we might need to take, we don't know exactly how many cases are going to come, but we do have plans in place.
But not during those
Hospitals like
specifics.
NUMC have like an isolation unit. Can you tell us specifically what the hospitals have
So-
to answer this?
So I'd let the hospitals speak for themselves, but they all are required to train for large numbers of incoming people. Our Director of Emergency Preparedness, Andy Simone, is in contact with the hospitals. Do you want to comment on the planning?
Yeah.
Sure.
So
Sorry.
all 11 hospitals do have isolation rooms. The number would depend upon how many people were sick. There is nobody sick right now. We would need the press to make sure that if something spread very quickly, for your message to be to the public to social distance, to make sure that people don't go to large congregations, to malls. But that is not happening right now. You do not need to spread that message. There is no fear right now that we do not have a case in Nassau County. But that would be the message that goes.
In addition to hospitals, does the plan include directions for schools and malls and all public places? Can you give us just some overriding hint as to what the plan is?
We can't comment on what the plan is until we understand exactly what we're dealing with. Right now, there is a deadly respiratory virus here, the flu. It is here. And so we have a plan to try and educate the public and get people vaccinated. A vaccine exists for influenza that doesn't yet exist for COVID-19. And when I think we really have to have a better understanding of what is the pathophysiology, what are the modes of transmission, how close do you need to be to somebody. You know, we talked about measles in past years where literally being in this room for a few minutes, it's so contagious, would put you at risk. But from what I know about COVID-19 and most coronaviruses, even you sitting here now are far enough away from me that you would not contract this from me. This is a heavy respiratory virus. So when it's breathed out, it falls to the floor within, they're saying right now the guidance is under 6 feet. So if you're 6 feet away from me, you're not at risk. So isolation rooms in hospitals are typically used when we need airborne evacuation of a room for, say, tuberculosis or measles. We don't even know if that would be required yet. It might just be keeping somebody, especially if there's large numbers of people, 6 feet away from each other or more. Coronaviruses are family of viruses that cause many common colds. It's probably everybody here has had a version of a coronavirus, a common cold at some point. This version of the coronavirus seems that it can have complications that can be more dangerous. But when these new viruses emerge, you typically hear about the most severe sick cases. So I urge everybody to stay calm. It is highly possible that there are many cases of people who had no symptoms at all or was so mild they didn't even realize they were sick. So we really need, and there have been 14 cases now confirmed in the United States. It's very hard to do an epidemiologic, and none in New York or Nassau County. It's very hard to give you epidemiologic information as far as what types of isolation we would need. So we're going on the best science available of typical coronaviruses. We know it's a heavy virus. Some respiratory viruses can live on surfaces, so I cannot emphasize enough how important it is, and they enter your body through mucous membranes. So I cannot emphasize, it's been said over and over, the value of hand washing and using sanitizing gels to, if you get the virus on your hands, eliminate it before it finds a way. Don't touch your face. My kids are so sick and tired of me saying if they scratch their face, don't touch your face. That's how viruses get into the body. So as of right now, even though this is emerging and may become a pandemic, it is essentially a respiratory virus. We are in respiratory virus season. We call it cold and flu season, but those are all respiratory viruses, and there are certain factors that they have in common and certain measures that we want everybody to take. If you're sick, please stay home. If you have to sneeze into the fold in your arm. If you're going to eat or touch your face, make sure you wash your hands, use sanitary gel beforehand. Yes?
To go backwards for a second, the folks who were told to voluntarily remove themselves, is that based on an honor system? Other than the health department checking in to see if they have a temperature, is there anyone actually checking to see that they're not going to work, not going to school?
So that's one of the differences between what would be a mandatory quarantine and this voluntary setup. So do either of you want to talk about the communications that we have to reassure? Go ahead. Debbie Kimmelstein is our Director of Communicable Disease
Hi.
Control.
Yes, we have, first we establish phone contact, and we talk to them at length. We go through a series of questions. During the interview, we ask them, do you understand and do you agree to stay separate? So they answer and respond to that question. Also, in addition, we make a plan with them. How do you want us to reach you? By phone, by email, by text, and we may call you intermittently, and we do that. The group of people, and we've had over 300 of them now, have been more or less very cooperative with us. They're there when we answer and call the phone, and they answer us. They will email us. If we don't hear from them and we email them, they'll respond right back to us, and we'll ask them to call by phone. So I have to say, by and large, everybody's understanding the magnitude of this and the anxiety. And even those that came back from China, say, and their work wouldn't necessarily want them at business. They know they were away. So people are being very cooperative with us.
Clarify, they're reporting their temperature every day?
We're doing more than just temperature. We're doing symptom reviews. So we would like to know if you have other symptoms as well, if you've developed a cough, if you've developed a sore throat, and in the event that somebody does develop any symptoms while they're in the period of the monitoring, we make arrangements for that individual to then be tested under controlled circumstances. So the healthcare provider is also protected, and the community is. And we have done that, and it's been very successful.
How many people have been tested?
I think we're up to 7 now, 6 or 7, since this. Well, I'm not sure. I'm going to say I might be 7. It might be 7. I don't have that number with me.
I think one was disqualified. So we've had 5 people in the past tested. They were in Nassau County. They were negative. There's 1 pending, probably going to be negative, but we certainly have taken measures to make sure that until we know for sure that that person understands to stay away from other people. So far, there have been 5 confirmed negative cases, 1 that's pending, and another which we disqualified.
Pending is due when? When do you expect?
Hopefully, and the testing is done by the CDC, so we get it to them as quickly as possible, and I don't know but they've been relatively quickly.
When was the testing done?
I don't know the exact moment, but we might get the result today.
No, when was the testing done? Yesterday, the day before?
I believe I don't know the exact time the sample was sent, but this was, I want to say Sunday night, maybe Monday morning. Yeah.
And County Executive, with all this overtime and working around the clock and weekends and nights, would the county be able to apply for any kind of federal or state aid to pay for some of these expenses? Those are conversations that we're having right now with our state and federal partners. I believe there are grants available, and those conversations are ongoing. This is a very fluid situation, and we are in constant communication with them about everything, including funding options.
Commissioner, County Executive, hearing you say there's so much we don't know about this, and it's not a criticism of you, you understand that this might not be terribly reassuring to the public?
What I can tell you, and what I would reassure the public about, is that I do believe that our team is ready for anything. The fact that we have 1,000 volunteer medical reserve experts, nurses, doctors, real health professionals, ready, who are trained, who are drilled all year round for any kind of situation like this, should be very reassuring to all of our residents. And the blood, sweat, and tears that our health department has put in this, I mean, Dr. Eisenstein was not exaggerating when he said it's all weekend, it's holidays, it's around the clock. We are on this. And I think our residents should be reassured that, you know, you're hearing in the headlines, it's a question of if, not when. We take this incredibly seriously, and we are up to the task.
Thank you.
Thank you.
you.